What are some of your favorites for supporting sleep, but then also some of the things you mentioned earlier related to the gut?
Well, I always give cancer patients high doses of melatonin. Now, I don't give it to them for sleep, but it, of course, impacts their sleep. A lot of research on melatonin was done at 20 milligrams at bedtime for transforming the cancer terrain, the tumor microenvironment. There's a lot of signaling that goes on in the immune system with melatonin. But melatonin is not a sedative, it's a dark signal to the brain. It tells the brain it's getting dark, it's get ready for sleep. So you also get that from using melatonin in the cancer terrain setting. So include that. I just give people magnesium and lavender usually as a start.
Mhm.
And quite often that's enough. If someone also has anxiety as part of it, we might think of using, supplements that are anxiolytic. But I just do simple things because I've already asked cancer patients to take a lot of supplements.
Mhm.
And so, more so, I ask them to turn off all their electronics, stop looking at blue light screens, which tell us it's morning, and to start winding down and intending to sleep, preparing their
Mhm.
nervous system to tip into the parasympathetic. I'm more interested in training people to repattern their stress response. And I'm a big proponent of meditation and teaching people self regulation. I think that's more powerful. I don't want to give them more and more pills. So I usually just start with melatonin and magnesium, usually magnesium glycinate, and some lavender. That's usually what I give them.
And what about for the gut? You mentioned earlier
Well,
some
the
things.
gut's a big project. So you have to think about prebiotics, probiotics, and in cancer patients, postbiotics. You need to have a lot of short chain fatty acids and
Mhm.
butyric acid in the gut because that's what really allows the healthy probiotic bacteria to colonize, right? And we've learned that giving billions and billions of probiotics, most of it passes right through you. So unless you have a lot of short chain fatty acids in there, you're not going to get colonization of all those healthy bacteria. So I like to use things, like the probiophage. I like to use that because that does help establish that ecosystem in the gut. A lot of cancer patients also have leaky gut because so many of the treatments are pro-inflammatory. So I like to use things like vitamin A that heal the epithelial lining, but also are important in pro differentiation of tumor cells. The more primitive, de-differentiated a tumor cell is, the harder it is to treat. The more differentiated it is, the easier it is to treat because there's receptors there that you can target. And so both vitamin D and vitamin A promote differentiation of cancer cells. A lot of cancers also have viral triggers. And so vitamin A is useful in
Mm.
that setting. We also know that vitamin D, of course, really modulates cancer immunity, also really protects the bone. There are many, many cancers that invade and metastasize to the bone. The more dense the bone is, the harder it is for the cancer to invade. So you want to use a vitamin D with vitamin K in it as well. So there's some ADK formulas where you can use everything all together at once. So I like to, I actually really like Designs for Health formulations because they are often higher milligram amounts than other companies, but they are often these really intelligent combinations. So you don't have to give 20 bottles of things. So I like the formulations very much. I use inflammatone quite a lot. Cancer itself is an inflammatory disease. And so if a patient has more baseline inflammation, they're more vulnerable to certain types of cancers. But at the same time, cancer cells secrete cytokines. And so it's very important to have a plan for inflammation. I usually track uh, CRP, IL-6 in the blood, and then also watch the white blood cells. You get a sense of the inflammatory biosystem, but also ferritin and ceruloplasmin go up in cancer. Those are other inflammatory markers in the cancer setting. So you can see what the landscape is. And then if you take a good history, you'll know if a patient has a more inflammatory history and they're more prone to have more inflammation as a cancer patient, and from the treatments are pro-inflammatory. And patients who have certain SNPs, single nucleotide polymorphisms in their genomics in TNF alpha, IL-1 and IL-6 tend to have more cancer-related inflammation and more cancer-related fatigue. So you can predict the patients that are going to suffer more in that way. And the primary cause of cancer-related fatigue is inflammation. After that, mitochondriopathies. After that, bone marrow suppression from their cancer treatments. So those are the types of things you want to pay attention to. And by addressing these, the patient does so much better. Their quality of life is better. Their capacity to withstand their treatments and be resilient is better.